Hi everybody, Michelle here. Today I'm joined by my daughter Ashlyn and we are going to be working on her calves. She is a barrel racer and she suffers from tight calves and very sore Achilles tendons. She's very tall and this is definitely her tension area. So we are working on it together today. She is manually warming up the tissue with the Theragun. I have just gotten off the exercise bike. So I am warm and ready to roll, and I am going to start with the mini blaster. Let's see if I can get myself over here. Here's the mini blaster, the face blaster. This is the mini paddle blaster. And the mini 2 are the tools that we will be using today. So I'm going to start myself by using some oil and putting that on my calves. Again, I just got off the exercise bike. I did a 15-minute ride, so my tissue is nice and warm. And I'm going to work on the other leg as well. So when you have tight calves, it can go many directions. It can go lower into the foot and cause plantar fasciitis. It can cause issues directly, like with Ash and her Achilles tendon. And it can also run up into the hamstrings. And I'll go back to massage school, and as my acupuncture teacher said, as it is above, it is below. I would say 9 times out of 10 in my massage therapy practice when I've worked on somebody, if they have tight traps, their calves are tight, and if they have tight calves, their traps are tight. As it is above, it is below. So it's just a good place to really be mindful of. We don't get a lot of break unless you're sedentary and sitting. This is definitely a spot that needs a lot of attention. So again, I'm going to start with the mini. Actually, to cover more surface area, I'm going to use the paddle first. And then that way when Ashlyn's ready, I'll shift this one off to her because I'm sure my arm will be tired by then. And I'm just going to take a quick peek at the clock. I'm going to go for about 2 to 3 minutes on each calf, warming it up. And again, it's a little more challenging for me with just the right hand normally when I'm working on my left leg, especially on the lateral side or the outside of my left leg. I would use my left arm. And don't hesitate to go into the foot or even around the knee area, but certainly lighten the pressure. You don't want to grind the little claws over your bony areas on the top of your feet, and quite frankly, the smaller tool is better for the surface of the feet. But I haven't oiled that area. I'm just going to focus on the calf, down into the Achilles. And this is a very important area. Ooh, there's a knot to focus on. And you want to use quick, brisk strokes back and forth, roughly from the ankle, not the ankle bone, above the ankle bone to just below the knee. And getting both sides. And then just to the lateral or the outside edge of your tibia or your shin bone is called the anterior tibialis anterior. And this is responsible for shin splints. So this is also a very good muscle and area to work for people that run a lot, basketball, a lot of pounding type activities, especially on a court, tennis. A lot of athletes that I worked with at the training center in the past, by athletes, would be known for a lot of shin activity from skiing. So transitioning here, so it's been about 3 minutes. And at the bottom of this Achilles, I'm getting almost a nerve tingly type feeling, almost like it's asleep. So that to me is saying there's definitely some restriction along my Achilles on this side. And that also correlates with My right leg has sustained some nerve damage when I had spine surgery. Well, prior to the spine surgery, I had a cyst on my spine that was there for a couple months, and it really aggravated some things and impaired some nerve function. I lost foot flexion and extension, but I was able to kind of work around it by muscling through it. But the nerve was definitely affected, and I think it's come back some, but certainly not 100%. So Ash, whenever you're ready, you can transition. I'll give you the oil. Switch. Put that up there. How are your calves feeling?
Weird, tingly from the vibrating so much.
Now, how did ya? Ha ha. How did they feel this morning when you got up? Just really tight?
Yeah.
You noticed it right away?
Yeah.
And right down into your Achilles?
Mm-hmm. Is that enough? Right?
So you want it to be nice and well lubricated, so it's going to slide. So let me feel your leg. Oh yeah, definitely. So you really want to put the oil more so on the meat of your calf where you're going to be working. So go liberally, apply a good amount so you have a good slide. Let me know when you're ready, and I'll okay. So you really want to go brisk, back and forth. So watch me, nice and quick. Wow. Okay, so I've been fascia blasting for quite a while. Look at how quickly that is getting red. Oh my gosh. She's taken like 10 strokes and it's beaming red. So that indicates hyperemia. Her muscle, her calves are so tight, there's not much blood flow going on in the muscle. So that's what this is going to do, is bring a lot of blood flow. What are you feeling? Tell me what's going on.
It itches and tingles kind of just because it rubs.
Right.
The rest of it's fine.
So move it around to the other side as well. And it's a fairly brisk stroke up and down. And you don't have to have a tremendous amount of pressure forcing inward. Really just think quick back and forth over the skin.
Am I going to be bruised?
You might. There may be some bruises that come to the surface. These are because you've worked out adhesions, which are muscular or fascial knots. So it's pretty common. Where you do feel extra sore spots, or maybe if you even feel a little bit of a knot, that'll be good to work on with that tool, the Mini 2, which has a little bit bigger claw. But the idea with this one is you want to go fairly quickly and fairly brisk, back and forth, and getting it real warmed up. So more than anything with this one, you want to be thinking quick. Back and forth, nice and brisk. Now, do you feel tension on the bottom of your feet?
Not really.
Okay, because sometimes what can happen is people that have very tight Achilles tendon, that tendon wraps right underneath your heel and it attaches right here at the bottom of your foot. So it will pull all of that fascia as well. And that is what's called plantar fasciitis.
Is that what Dad has?
That's what your dad had. Had or has?
Has.
So you need to teach this to your dad?
I get a rolling pin and roll his calves.
And that's certainly good. That's similar to foam rolling, right?
Mm-hmm.
But you're missing the claws.
Right.
They're like little fingers, and that kind of knead individually and work that tissue apart and help to not just smush it and roll it like a rolling pin, but to break it up and smooth it out.
Should I switch legs?
You certainly can.
Oh my god.
What are you feeling?
It's just so warm now.
That's good. So warm tissue is ideal to work the muscle and the fascia, to work any of the tissue. Ideally, you don't want to work on something cold. If you would think of a dried out rubber band and you pull it, what's going to happen?
It's gonna snap.
It's going to snap. We don't want that to happen to our muscles or our ligaments and tendons. So warming them up is ideal before exercise, of course, and you want to warm things up before you work on them. Okay, I've had a good warming session, so you got a couple minutes left on there. I'm going to move on to the bigger claw, and I'm really going to use 2 of these claws to focus right around my Achilles tendon. So I'll come this way and show right here, getting in nice and deep, working that calf. And I can definitely feel some crunchies in there. So I'm certainly working that in different angles. There. There's a good visual. You can put your foot up here too if you'd like. Here, let me turn it a little bit. There we go. That work better?
Yes.
Now turning to get the other side. It's challenging. And if you are somebody that suffers from the shin splints, again, taking really just one claw, well, 2 of these claws here, and focusing on that front muscle. Right up and down. Again, avoiding the bony areas. You don't want to grind over your bone, but you want to get close to it, right along the edge, because that's where the attachment of the muscle is. Where muscles are, they attach to the bones. And of course, they have an origin and insertion, a top and a bottom where they anchor for their movement purposes. But every muscle is wrapped. Inside each muscle, each fiber is wrapped, like if you will, with saran wrap. And that is what we're working at, is to loosen the packaging of our muscles, if you will. And it extends from the top of our head to the tips of our toes, and it intertwines and intersects with all of our organs and tissues. And normally I would say as we age this is imperative, but she's 12 and it's important for her as well. All right, I'm going to switch to the other leg.
Is my time up?
Yep, go ahead. Oh, well, you gotta wait a minute. Let me get this leg done. I only have one of these
Do you want
tools.
me to use this one?
Sure. It's a little lighter. Are you noticing any difference in what you're feeling in your legs?
Very hot and tingly.
So the warmth is from the blood flow and the circulation, and the tingly again is much the same thing. From the rubbing, for one, superficially on the skin, but also bringing that circulation. So really, yeah, this Achilles tendon is a sore one for me. And not even so much sore, but I'm really feeling a lot of congestion, crunchies in there. Quick, brisk strokes are what we want to go for. And then on the ends of these are the little nuggets. And you can use these tips if you have a spot to get in, and you poke and wiggle, poke and wiggle, poke and wiggle. A lot of times I will single out one of the bigger claws and actually use that. Sometimes these nuggets are just a little too aggressive, I find. All right, I'm going to transition this over to you and start with whichever leg you want. And if you want to put your foot up here for easier reaching, you certainly can. And just for the fact that we only have one of the larger claws, which is what you move to, the smaller claws are the prep tool for warming things up. The larger claw is really to get deeper and manipulate the fascia in a different manner to really break things up and smooth things out. So really go back and forth from that ankle, get a nice brisk. Do you have enough oil? Reapplying oil is crucial because you want a really good glide. And as it's winter, our skin soaks up the oil. It needs moisture. So sometimes even before you start with your warm-up tool, that oil will be gone.
It's one big knot.
One big knot?
I feel it.
Put your leg over here a little bit more. Right there?
Mm-hmm.
So that's a spot where you may want to use, good job, really focusing on that calf, your gastrocnemius, and a lot of red color already coming. That's awesome. You're doing a great job. Is it feeling any better?
Yeah.
I'm not sure if that was English or not.
Yes and no.
Yes and no. So how is it feeling better?
Because it hurts better.
Okay. And it's not feeling good because you're touching it?
Yes.
Okay. However, in knowing that you need to improve this area, you know you have to touch it and work on it.
Mm-hmm.
Because what would happen if you didn't work on this area?
It gets worse.
Day 2, typically, after an exercise or workout, is the far more, for me anyway, painful day. Day 2, that delayed onset muscle soreness is brutal. So getting ahead of that whenever possible is very important, and I'm very happy you're doing this.
Mm-hmm. Me too.
She was here this morning after barn chores at 8 o'clock, maybe not even, knocking on the door saying, "Can we fascia blast?" I was like, "Whoa, what's hurting you this morning?"
All of it.
All of it, from your head to your toes?
Mm-hmm.
But this is the most dominant
Yeah.
area?
Mm-hmm.
What else is hurting? What would be number 2 behind your calves? Hamstrings?
Yeah.
She is a very tight girl. She's taller than I am at 12. And she's very tight. Flexibility is not her game. She's very strong, but we're working on the flexibility because ultimately keeping and maintaining that flexibility is going to ensure better posture and reduce the chances of injury. So being so tight, eventually something will give somewhere. With prolonged, repetitive tension in the body, something as simple. This is a great one. A friend of mine recently went in for an MRI at the hospital, and she works at a desk. She has for the last 15 or so years, and she was in the changing room, and she went to put her shoe on. She was seated, went to get her shoe, and her back went out. And she slid like a cartoon character out of the seat onto the floor. And when one of the girl who came in for the MRI was somebody that we had went to school with, and she knocked on the door, and my friend's laying on the floor. And she's like, "I can't get up." And it took she ended up getting put into a wheelchair and wheeled to her car. And this persisted, her injury, going to the chiropractor, several visits, and it went on for almost a couple weeks before she gradually got better. And ultimately, this comes back to her body is so tight, she's used to being seated all the time, and when she went to move in a different position than what her body was normally used to, it said, oh no, and something let loose. So again, just staying flexible, absolutely shift. Staying flexible is essential, not only as we age, it's for youth too, but to avoid injury. Injury prevention. Holy, okay. I'm gonna tell you, I'm really over the ladybug situation. It's the dead of winter and they've been coming out of the woodwork, literally. I like ladybugs, don't get me wrong, but... So, funny story, my ex-husband woke up one morning, said, oh, my ear is itchy, my ear is itchy. I was like, well, go in the bathroom, use a Q-tip, whatever. And he went and got the Q-tip just about to his ear, and a ladybug crawled out. And I was like, so, needless to say, when I love ladybugs, but they can be outside. They don't need to be in the house. Because just a quick little flutter of their wings, and they're across the room, and I don't want any ladybugs in my ear. Not into it. So this is pretty much a wrap on doing the calf fascia blasting. You could also transition this if you are somebody that's suffering from plantar fasciitis. You want to work both the bottom all the way down as well as the top of the foot. And on the top of the foot, you really want to get in between the metatarsals gently. I did this the other day and I actually had a pretty good bruise in there. But work in between all the way down to the toes, on the top of the ankle, around the ankle joints, really loosening this whole area up. If you're suffering from plantar fasciitis, ankle injuries, post-surgery, of course, get clearance from your doctor. I'm not here to treat, diagnose, or cure anything, just giving recommendations on freeing up some muscles, recovery. I've had such a gamut of clients use this, from linemen, the National Grid guys, to strongmen who use these, bodybuilders, CrossFit athletes, Olympic athletes. So it's not just for two girls sitting at home, trying to improve the look of their lower leg. It's really functional. And again, it's really working on loosening, mobilizing, and injury prevention. So hopefully this video helps you out. If you have any questions, put them in the comments below, and happy blasting. Keep those calves free.